The DR full leg full spine system comprises a detector positioner, an optional external collimator and a control box. The system is used to perform full leg or full spine X-ray images. An examination comprises 2 or 3 exposures. After each exposure, the user presses the next button on the control box to move the detector to the next position. Music image processing and easy stitch technology provide high-precision full leg full spine imaging. This video shows the examination workflow without the optional external collimator. The patient enters the examination room. Position the patient in front of the detector positioner. Shift the detector positioner by the easy lift to fit the desired region of interest. Center the tube to the detector positioner. Adjust collimation height to the marks on the stitching grid. Adjust collimation width. Rotate the tube to the first exposure, indicated by a center line. Inform the patient about the number of exposures. Normal breathing, but no movement until the last exposure is finished. Each partial workflow step takes about 10 to 15 seconds. Go into the control room and take the first exposure. Press the button on the control box to move the detector to the next position. Rotate the tube to horizontal position. Take the second exposure. Press the button on the control box to move the detector to the next position. Center the tube to the third exposure. Take the third exposure. After the third exposure, the images are stitched right away. The patient can move again. Check image quality. If image quality is okay, release the patient. The full leg full spine workflow is finished.